Hello everyone and welcome to my channel. My name is Bridget and this is Bridging Healthcare. How are you doing and how is work? This channel I focus on talking to healthcare professionals and would-be healthcare professionals to give you guide on how you can be both effective and efficient at your job and do your job in the most professional, person-centered form. We are a profession. All right. So don't just think, oh, I'm just a regular carer. We're a profession. And the seriousness you use to take your job, it will also determine the seriousness that you put into it, the seriousness that you use to support your service users. And that is also how you're going to be treated. So, and that's why I am here again. Thank you for coming again and again. If you've not subscribed to my channel, please subscribe, like, and share. And today I want to discuss something quite interesting. So sit down, relax, get a cup of tea and get a pen and paper and let us talk. Thank you. So today I want to talk about the code of conduct, the right ethics of a support worker, a health and social care worker, a carer, a social worker, wherever you fall in on the spectrum, we have a code of conduct, we have a work ethic that is expected of a healthcare professional. And the truth is that this work ethic, they are put in place, one, to ensure that the care that is given is benefiting the public. That means that the people that you are supporting, the care is both effective and they are responsive to the care. So it protects the community, the people that will go to support. Some of us support people in the hospital, some of us support people in their own homes, and some of us support people in a care home or in a supported living space. The purpose of this ethics and this code of conduct, especially in the UK, is put in place to make sure that individuals who are vulnerable are protected, people in the community are protected, that the support that we give is regulated, is guided by laws that are followed, and that we are not just shadowboxing as healthcare professionals. We are prepared to support and to assist in any form of circumstance we find ourselves. So I'm going to be mentioning it in no particular order. Truth is, as a healthcare professional, you need to help yourself. You need to study. I've said it times and time again in this channel that everyone, the day you stop learning, you start dying. So don't just think that our job is just a hands-on job. I will learn. No, you have to study to show yourself approved. A workman that needs not to be ashamed. You are a workman. You don't want to be ashamed in your job, right? So the major purpose of this ethics is to ensure that we carry out our services in a manner that is both effective and it is beneficial to the individual, and nobody is feeling demotivated, or the service does not meet the standard. Because there's a standard of care that should be given, and we as healthcare professionals should maintain that standard. First of all, in no particular order, is equality and diversity. There are many free courses on equality and diversity. And as healthcare professionals, you should not see color, you should not see race, you should not see sexual orientation. You should be able to support anybody irrespective of their color, their skin type, their race, their language, their tongue, their ethnic diversity, their sexual orientation, and their choice of social standing. So you won't say, oh, because this person looks like this, I won't support them. We do not see color. We do not see those things. And that is the first thing that you must settle in your mind, that I'm not the kind of person that will go and support somebody and say, oh, I will not support this person because this person is not my skin type. No, I must be able to support everyone in the same quality and level. I should not support or because this person is being aggressive, maybe due to their medical condition or whatever is going on with them. And then I will say I will not support them adequately because of how I will do my best. I will give equal standard support. Because we're human beings. Sometimes you say, oh, this one, the way he talks to me, I will not do this. No. As a professional, you must be able to, respect that equality and diversity, giving the care to everyone the way it is written in your care plan, and giving it expressly, professionally. What you will do for A, you should do for B. Don't say, it's when I get to this client's home, because they always serve me tea, I will do this for them. No. That alone, you are already ready. You're already breaking the rules of the ethics of being a care professional. Because if somebody is allowing you come into their home, to support them, and family trust you to come into their home, to trust, they did not see your DBS before you do that, then you should give a very equal equity, maintain that equality. What I will not do this because they smiled. I would do it because that is what I would do. We must respect our service users. We must promote dignity and respect. It means that you don't say because this person is in coma or the person cannot get out of bed, I will just expose them like that. You close the doors. Just the way you will close the door if you are supporting yourself or your family member. So you must promote respect and dignity. Dignity must be treated with highest form of respect. Choice. People's choice must be respected. So if the person says, I do not want to take medication, and they've not been deemed to lack capacity in making that decision, they have the right not to take that medication. These are the code and ethics. You must be on time. You must not miss a visit. If the visit has been allocated to you and you are aware, you must not miss it. If you miss it, it's a safeguarding. Guys, you must not miss your shift. It better you are late to that shift than you did not show up. Then you must not miss your tasks. Somebody has been allocated medication and you do not give. That is safeguarding. It is neglect. You did not give the medication that you were supposed to give. And maybe the person is underdosed now or overdosed. Now the person can break down and something can happen to them and it might be tied to that and you are liable. These are some of the codes and ethics of health and social care. That's why when you're coming into this field, don't think that you're just coming to play. Oh, well, we just do this. No. Everything must be done with dignity and respect. Everything must be carried out with a lot of finesse. You must do it the way you were trained to do the job. You're supporting an individual in changing their continence support. You must monitor skin integrity. All these things are what makes you effective and efficient. All these things are the things that pick out. You must, it's all in health and social care. It can be tagged as financial extortion if you are beginning to collect service user money from service user. A job that you are paid to do. Then they give you gift. You did not call your company. You just carry the gift and then you are extorting things from them. No, it's not allowed. These are ethics because it's a profession. You are not doing them a favor. You are doing a job and you are being paid to do it. So even if you are volunteering, you chose to volunteer. It's very important to note that if this client is showing appreciation and they are giving, call your supervisor. Explain to them, we're not supposed to be taking gifts from clients because we're not doing them a favor. We're doing a job. You're not also doing your company a favor. You are doing a job that you're being paid for. There are so many things you need to study. Please go online. I'll put some links in the description below and read. We are a profession and we must carry out our profession with utmost respect. Remember, equality and diversity. You must respect people. You must give everybody that care, that same level of care, irrespective of what their orientation, whatever it is. Even if somebody lives with a condition that is making them, they are not able to understand what is going on, they are not able to appropriate what you are doing, still give the utmost respect. Do you know, when I used to work as a nurse in the hospital, I once had a client that passed away. While giving last respect, which is what we were trained to do, you must explain to the person, I want to clean you up now, I want to wipe you, you must do that. You must be talking to them, even if the individual is in coma. It is called respecting their dignity. You must let people know what you're about to do, even if it is a child you're supporting. I hope this video has been able to help you to see that our work is a profession and we must follow these ethics. Please go and research further. And if you want me to talk about something, you can send me an email at ezobiakobridges@gmail.com and I'll be happy to help. Thank you so much for coming again and again and again. Please tell your friends about this channel. Subscribe, like, and share. Thank you so much and see you in the next one. Keep being fabulous. Bye.